So good morning, everyone. I'm Dr. M. Singh. I'm Director Professor in the department, and I'll be taking the topic on related Millennium Development Goals and related Sustainable Development Goals. Now, before going into details of this, let me first ask you one question. Has everyone dreamt of a world where the world is free from diseases, where the world is free from poverty, hunger, and also the world is free from all the environmental pollutions? Now, I think many of you might have dreamt of it, and this is where this health related this Millennium Development Goals and Sustainable Development Goals come into picture. So in this lecture, what I would be covering is basically on the Millennium Development Goals, and more emphasis would be given on the health related Millennium Development Goals, the origin, the components, the indicators and performance, global as well as Indian context wherever available. And also little later, I'll also be talking about the Sustainable Development Goals, the various components, and also more focus on the Sustainable Development Goal number 3, that is related with health directly, and also the different performances in relation to different targets and also goals of the Sustainable Development Goals till 2019 based on one of the reports published by Niti Aayog. So with that, we begin with this quote from Mimi Kennedy, that is one of the actress and also activists, who said that all humans change. Development is our life. Transition in labor is the most painful time. Without change, there is no growth. So that means we are all towards development. And before this Millennium Development Goals, I would also like to highlight what are the different problems in the world, which is still existing despite the Millennium Development Goals, which came into picture since 2000, and this was till it was occurring till 2025 December. But still then there was still some problems were remaining. So it is based on that. Let us listen to this video. This is from the Test Tube News, and you can find out the different problems which are still existing in the blog. So I think you might have learned different problems from this video, and those videos are still pertinent in the context of the sustainable development goals. But before that also those problems are still existing. So before that, there was a Millennium Declaration. Now coming to the Millennium Development Goals, there was a Millennium Declaration whereby 189 nations all over the globe, they came into close conversation and also made a promise to make the world free from extreme poverty and multiple deprivations. And this pledge became what is known as the 8 Millennium Development Goals, and this was to be achieved by 2015. And again, there was some meeting. A committee was recommended that in September 2010, that this should work, the world should work towards the progress of the Millennium Development Goals since it was lagging behind. So you can see here the resolution which was adopted by the General Assembly and by the United Nations, which is in the center. You can see the United Nations Millennium Declaration, which was declared on 18th of September 2000. Now coming to the development goals. So in this, there are 8 goals. I'm coming to the second line. That is 8 goals, 18 targets, and 48 indicators that are to be achieved by 2015. And out of these, 6 goals and 18 indicators relate directly to health. Although other indicators are also related indirectly to health, but these are the 6 goals which I'll be covering subsequently. And subsequently, there was an interagency and expert group on the Millennium Development Goal indicators in 2008. They have revised the goals to 8, 21 targets, and also 60 indicators. And for each of these MDG, the targets set for the 2015, the indicators were there to monitor progress from 1990 levels. So that means the baseline indicators were 1990, and based on it by 2015, how much of the indicators have been fulfilled. And India's MDG framework consists of 8 goals, and 12 out of these 18 targets, 1 to 11 and 18, and there are 35 indicators. So now understanding the components of the MDG, for this, I would like to give you a situation which is existing in a village in rural India. Like you can think of that all these problems starting with, on the left hand side, you can start off the people who are poor with hunger staying in a village. The problem here is the poverty and hunger, and illiteracy is very common, and they prefer male child over the female child is still existing. So there is gender bias and inequality in gender, and many children die due to lack of immunization, and that is leading to child mortality. There is still immunization is not 100% in the rural area as of now, and so that is one of the biggest problems. And similarly, maternal deaths are also common because of the lack of health facility, and also majority of them not coming to the institutions for delivery. And there are many other infectious illnesses like HIV/AIDS, malaria, and other diseases which are also common in the village. And in the village environment, you can see that pollution could also be common, which can be due to open defecation and lack of safe drinking water, that is poor environment. And so for all these problems, what is needed is partnership between different agencies, and which can lead to improvement of all these facilities, this partnership. So if we look at these different problems, these are common problems which are existing in the village and also in urban slum areas of the country. So these problems are included under the Millennium Development Goals. So you can think of this situation, and you can remember the different aspects of the Millennium Development Goals. So what are the actions needed for each of these? For the first one, poverty and hunger, the eradication of poverty and hunger. And for the second one, we need to have universal primary education. Then for the third one, we should be promoting gender equality, empower women. And the fourth one, we should reduce child mortality by taking all the various steps to reduce childhood illnesses. And the fifth one, to improve the maternal health. And sixth one, again, combating those diseases which are common. And seventh one is sustainable, clean environment is needed. And the last one is development of partnership for development. So this gives you a composite picture of the various aspects of the Millennium Development Goals. So here are the 8 goals of the Millennium Development Goals to be achieved by 2015. The first one is eradicate extreme hunger and poverty. Second is achieve universal primary education. Third is promote gender equality and empower women. The fourth one is reduce child mortality. The fifth one is improve maternal health. And the sixth one is combat HIV/AIDS, malaria, and other diseases. And seventh one is ensure environmental sustainability. And the last one is develop a global partnership for development. So now I'll come to the different goals and targets for each of them separately and subsequently. Now on the left side, the first goal that is related to the health, I'm coming to this related to the health. The first goal is again directly related to the health, that eradicate poverty and hunger. The fourth one, reduce child mortality. The fifth one is improve maternal health. The sixth one is combat HIV/AIDS, malaria, and other diseases. Seventh, ensures environmental sustainability. And also indirectly, development of global partnership for development. Now the targets on the right hand side, for the first one, eradication of poverty and hunger, this is to halve, that is to reduce 50%. Between 1990 and 2015, the proportion of people who suffer from hunger, so 50% reduction in hunger. The second one is reduction by 2/3, nearly about 67% between 1990 and 2015 for the under 5 mortality rate. And for the fifth one, we have two targets, 5A, that is reduced by 3/4, that is 75% between 1990 and 2015, the maternal mortality ratio. And second one is achieved by 2015, universal access to reproductive health. The sixth one is combating the HIV/AIDS, malaria, and other diseases. The first one target is have halted by 2015 and begun to reverse the spread of HIV/AIDS. And second one is achieved by 2010, universal access to treatment for HIV/AIDS for all those who need it. And sixth one is have halted by 2015 and begun to reverse the incidence of malaria and other major diseases. For the seventh goal, we have one target, that is 7C, halve by 2015, that is again reduction by 50%, the proportion of people without sustainable access to safe drinking water and basic sanitation. And 8, the last one, that is 8E, the target is in cooperation with pharmaceutical companies provide access to affordable essential drugs in developing countries. Now coming to the first goal, the eradicate extreme poverty and hunger. Now here the criteria is taken to be, for the poverty is taken to be less than $1.25 a day. But originally it was, when Millennium Development Goal was fixed, that time it was $1, but now it is $1.25 per day. And in this, we can still see that their undernutrition is the underlying cause of death in majority of the cases, around 45% of all deaths in under 5 children. And that undernutrition can be starting from the womb and after that also. And so it starts with the fetal growth restriction, stunting, wasting, and further the deficiencies of other micro and macronutrients, vitamin A, zinc, and also the suboptimal breastfeeding. These are the various components which are leading to undernutrition. Now the status globally from 1990 to 2015 is that hunger has been reduced from 47% to 14%. And undernutrition in developing countries, it has reduced from 23% up to 13%. So in India, the achievement is only the poverty reduction based on the criteria above is achieved, and not for the hunger. Now the indicators for India, and in this again on the right hand side you can see on the table the indicators for the first one, that is half between 1990 and 2015 proportion of people who suffer from hunger. The indicators are prevalence of underweight children below 5 years. In the baseline indicator, it indicated that is 53.4 as the prevalence, and it has reduced to 33.7 by 2015. And the second indicator is proportion of the population below minimum level of dietary energy consumption, that has reduced from 25 in 1991 to 17.5. There hardly some reduction is there in this indicator. Now this figure will tell you about the proportion of underweight children below 3 years, and this is from the report published by the National Family Health Survey under the Ministry of Health and Family Welfare, and this is based on the achievements of the various states. So the different states have got different targets based on the levels which are existing in 1990. So if we look at this figure, we can see here there are two states only, Jammu and Kashmir and Himachal Pradesh. You can see here by the arrow, the blue color indicates the achievement, and the red one indicates the target. So they have achieved the target for reduction in the proportion of underweight children. However, you can see all the other states and union territories, including Kerala and Delhi, they have not achieved this target. Now, the next one, health-related development goal, is 4, that is reduction in the child mortality. Now, in this, if we look at the figures globally, there is significant progress has been there. And in 2013, about 6.3 million children under 5 children died, as compared to 12.7 million children who died in 1990. And between 1990 and 2013, the under 5 mortality rate declined by 49%, from 90 deaths per 1,000 live births to 46. Then the global rate of decline has accelerated from 1.2% per annum during 1990 to 1995, and it accelerated to 4% during 2005 to 2013. However, the world didn't achieve the target in this regard, that is reduction of 2/3 reduction, but we achieved only 53% reduction. So more countries achieve high levels of immunization coverage in 2013, like 66% of the member states reached about 90% coverage. And in 2013, again, the global measles immunization coverage is one of the sensitive indicators, was 84% among children aged 12 to 23 months. During 2000 to 2013, the estimated measles that decreased by 74% from 481,000 to 124,000. So there has been reduction on all fronts, but the achievement in reduction in relation to 67% has not been achieved. Now this is for India, the achievements. On the right hand side, I've written these indicators. The under 5 mortality rate per 1,000 live births, the baseline was 112 in 1990, and it reduced to 47.7 per 1,000 live births in 2015. That is approximately 57% reduction. As in regards to the infant mortality rate, in 1990 it was 80, and it has reduced to 38 by 2015. And proportion of 1-year-old immunized for measles, it has increased substantially from 32% in 1990 to 83% in 2015. And here again, I give you another figure from sample registration system for the under 5 mortality rate achievement versus vis-a-vis the target for the 2015 for the states, for the bigger states. Now you can see here, West Bengal, Uttar Pradesh, Gujarat, Karnataka, Kerala, and Maharashtra, they have achieved the targets, and that is target that is shown in the green line, and the achievement is shown by this blue line. You can all see this example of Gujarat here. It is almost merging here, and West Bengal also a little more than that. What is the target that was set for 2015? But in addition to this, if we look at 3 other states, one is Tamil Nadu, Delhi, and another is Jammu and Kashmir, where the achievement is much more than the target which were kept for 2015. And this is for the infant mortality rate achievement for the bigger states. Again, if you look at this, again, the same condition applies here. The blue line indicates the achievement, and the Green one indicates the targets. And in this, we can see Tamil Nadu, Maharashtra. I think these are the two states which have achieved the target for the IMR by 2015, but all other states have not met the target by 2015. Now coming to the next health-related development goal number 5, that is reduction in the maternal health, maternal mortality, that is improvement of the maternal health. There has been again significant reduction in the maternal deaths from the estimated 523,000 in 1990 to 289,000 in 2013. This is globally, and the rate of decline was less than half of what was needed to achieve the goal, and that was 75%. And so that means we are still lagging behind in this maternal health improvement. In 2012, 64% of the women aged 15 to 49 years married or in a consensual union, they were using some form of contraception. And 12% of them were in the unmet need. They wanted to stop or postpone childbearing, but they were not using the contraception. And the proportion of women receiving antenatal care at least once during pregnancy was about 83% for the period from 2007 to 2014. And if we consider a minimum of 4 or more visits, the figure, it comes down to 64%. It is still very less. And similarly, another important indicator for the maternal health is delivery by the skilled personnel, and the percentage of the births attended by skilled personnel was above 90% in 3 of the 6 WHO regions. However, in South Asia and Sub-Sahara, it is below 50%. You can see lying between 45 to 46%. So there is a scope for improvement in this area as well. And so with regards to the maternal health, we also talk about other indicators like adolescent birth rate. The adolescent birth rate decline is greater in developed countries, that is by 50%, as compared to the developing countries, that is 13%. In South Asia, where India is also included, it's what 47% decline. And similarly, for the antenatal visit coverage, it doubled in developing regions from 31% to 60% during this period. So some of the targets, again, I'll be showing on the right-hand side. Here, we have not achieved what globally and Indian context, this goal number 5, in relation to the maternal health. The maternal mortality ratio in Indian context, it was 420 per lakh live births in 1990. It has declined to 167, and that is 60% reduction by 2015. The recent figure is near about 122. It is still lesser than this, but we have not met the target by 2015. The proportion of births attended by skilled personnel, it increased from 36% in 1990 to 52 to 81% in various parts of the country by 2015. The contraceptive prevalence rate, we didn't have any figure for 1990, but as of now it is that is in 2015 that was 55%. Adolescent birth rate, again in 2013 it was 31.5. We didn't have the baseline comparable figures. Antenatal coverage 3 or more in percentage, it is again nearly 50% only. The unmet need for family planning, the percentage wise, is again 21%. So this figure again gives you the MMR in different states, and you can see the achievements, the target in the green line, and the achievements in the blue line. None of the other states have achieved this target. So now coming to the maternal deaths in India, we have a small video clip, and let us listen to this, and you can also have some idea about how much we have achieved in this. So this is all about the maternal death in India, and what has been highlighted in this is regarding the unavailability of the blood. Uh, and so coming to the next health-related goal, that is goal number 6, combating of HIV, AIDS, malaria, and other diseases. On the left-hand side, I have shown you the various targets, and on the right-hand side, the indicators for this for India. And I'm just coming to the indicators. HIV prevalence among the young people, that is 15 to 24% in percentage. We didn't have any baseline information on 1990, but for males and female, it is 0.1 and 0.1%. And even for 15 to 49 years also, for 2012, the figure is 0.1. The condom use in high-risk population, we didn't have any figure for 1990, but it is for males 32 and 17 for females by 2012. The ratio of children orphan as compared to non-orphan in the schools, because of the HIV infection. In 1990, we didn't have any figure, but by 2012, that was 72. Now, the status on the right-hand side, globally, with relation to the HIV, we have achieved the target. Now, coming to the malaria, we can see here on the left-hand side, malaria incidence declined by 37%. The mortality also declined by 58%. The tuberculosis detection rate, it increased from 38% to 68%. And so on the right-hand side, the indicators are the malaria death per lakh population in children aged 0 to 4 years. We didn't have any figure for 1990, but it is 8 for 2010. Malaria death rate per thousand for all the ages in the population is 2.3 by 2012, and proportion of the population in malaria risk areas using insecticide treated nets, we don't have any figure available for this. And similarly, the proportion of population under 5 years with fever being treated with anti-malarial drug, we didn't have any figure for 1990, but it is 8% for 2012. Now coming to the incidence, target 60 for the tuberculosis. On the right hand side, indicators are, and the achievements for India also is given here. Tuberculosis death rate per thousand per lakh population, 1990 we didn't have any figure, but 2013 it was 19 per lakh population. The tuberculosis death rate, it is there among these people who died among the tuberculosis patients. And tuberculosis prevalence rate per lakh population is among the population. We didn't have any figure for 1990, but 2013 it is 211, still quite high. The proportion of smear positive pulmonary tuberculosis cases detected and put under directly observed treatment short course, just dots. We didn't have any figure for 1990, but the comparable figure available as of 2012 is 64. And number of in terms of proportion, the smear positive pulmonary tuberculosis cases which are detected and cured under the dots by 2012, it is 88%, which is quite high. So now coming to this MDG 6 again, looking at some of the figures, you can see the figure here, the trend showing HIV prevalence among pregnant women aged 15 to 24 years. We can see here from 2004 onwards, that is 0.86, it has declined to 0.25 by 2015. And similarly, for a trend in the annual parasite incidence for malaria, it has declined from 2.09 in 2000 to 0.64 by 2015. So there has been substantial decline in relation to the malaria. Now, in relation to the malaria, about half of the world's population is at risk, and an estimated 198 million cases in 2013 with 584,000 deaths, because mostly in children under age, which was occurring in Africa. And during 2002-2013, the incidence of malaria and the mortality rate have both fallen globally. That was by 30% incidence and 47% mortality rate. So the coverage of the intervention is again known by some of the other indicators like insecticide treated nets and indoor residual spraying, which are increased, but all these interventions need to be sustained in order to prevent the resurgence of the malaria and also deaths caused by malaria. And globally, the MDG target for halting 2015 and beginning to reverse the incidence of malaria has already been met. Now, similarly for tuberculosis also, that we have achieved the MDG target for tuberculosis, and it has started reversing the spread by 2015. In 2013, there was an estimate of 9 million new cases and 1.5 million deaths, which includes 360,000 deaths among HIV positive people who are also affected with tuberculosis. Now, globally, the treatment success rate has been sustained at a higher level since 2007 at or above the target of 85%. But this has been again marred by the emergence of the multi-drug resistant tuberculosis, the MDR tuberculosis, and which is now causing a lot of problems, and which can result in, again, inadequate treatment, which is resulting from the inefficient treatment, and these are causing problems for the tuberculosis control. Now, for the other diseases, the neglected tropical diseases, there are many, and starting from different countries in the world. You can start with the African trypanosomiasis. Only few cases that have been reported in 2013, that is around 6,314, and this was the lowest recorded level in the past 50 years. Now this has been targeted for elimination by 2020. Another disease is dracunculiasis, which has already been eradicated from India, but it is again on the verge of eradication with a historic low of reported cases, that is 126 in 2014, and WHO is again putting all the efforts for interrupting the transmission of the disease. There are plans to eliminate leprosy as a public health problem worldwide by 2020, and this has been implemented globally. Similarly, elimination of visceral dysbiosis as a public health problem in Indian subcontinent by 2020 is on track, with greater than 75% reduction in the incident cases which have been recorded since the launch of the program in 2005. And another parasitic disease, the lymphatic filariasis, more than 5 billion treatments have been delivered since 2000 to stop its spread, and also in 73 non-endemic countries, and out of these 39 are on track to achieve elimination by 2020. Now coming to the other MDG 7, it is again related with health, that is environment. So environmental sustainability is again very much important from our perspective. The progress report has been like this. In 2012, 90% of the population used an improved source of drinking water as compared to 76% in 1990, but still 100% target has not been met. And regarding the basic sanitation, the current rates of progress are very slow to meet the target globally. And in 2012, 2.5 billion people do not have access to improved sanitation facilities, with 1 billion people still practicing open defecation. So it is very high. And the people living in urban areas without access to improve sanitation is still increasing because of the rapid growth in the size of the urban populations. So these are again some of the issues related with environmental sustainability. However, based on the target for the safe drinking water, the MDG target is met for access to safe drinking water globally. Now, with regards to the Indian situation, the indicators, the proportion of population using biomass fuel in 1990, the rate was not available, but in 2013, it is 64. And similarly, for safe drinking water and basic sanitation, the indicators are the proportion of the population with sustainable access to an improved water source in a rural area is 87% in 2011 as compared to 61% in 1990. And another indicator is proportion of population with sustainable access to an improved water source in urban areas. It increased slightly from 88% to 93% in 2012. Then with regards to the slum population and improve sanitation in that, the indicator here is the proportion in percentage of the urban population with access to improved sanitation. It improved marginally from 44% 1990 figures to 60% in 2011. Now, we shall look at this again, another video clip where the problem of water is shown in one of the African countries in Tanzania. The similar condition also exists in some of the states in India, like in Rajasthan, where women has to go long distances, about 4 to 5 kilometers a day to fetch water. So we can see this video. MDG 7, 2.3 billion people gain access to clean drinking water. In Tanzania, the long walk for water So this is about the water problem, and that is still facing the world, and we are still will be facing this problem subsequently as well. Now, moving on to the next health-related goal, the MDG 8 Global Partnership for Development. Here we can see that in relation and also in coordination with the pharmaceutical companies, the availability of affordable essential medicines in developing countries is a target, and many people still feel that there is a scarcity of medicines in the public sector, and so majority of them buy from the private sector. And survey during 2007 to 2013, it showed that the average availability of the selected generic medicines in 21 low and middle income countries was only 55% in the public sector. And the greatest price paid by the patient was suffering from the chronic diseases. And effective treatment for majority of the global chronic diseases burden exists, yet universal access to remains out of reach. So this is again another problem which we need to resolve. And now with regards to India, the indicator for this is the proportion of the population with access to affordable essential drugs on a sustainable basis. There has been dramatic improvement from 44% in 1990 to 80% in 1997. Now coming to the next, the progress of the MDGs, you can see that the number of deaths of under 5 children fell from 12.7 million in 1990 to 6.3 million in 2013. That is almost about 50% reduction in the deaths. In developing countries, percentage of the underweight children under 5 years fell from 28% in 1990 to 17% in 2013. Globally, new HIV infections declined by 38% between 2001 and 2013. Existing cases of tuberculosis have declined, along with deaths among the HIV-negative tuberculosis cases. In 2010, World met on the United Nations Millennium Development Goals. The target on access to safe drinking water as measured by the indicator of access to improved drinking water sources, but more needs to be done to achieve this sanitation target. So this is in brief about the progress of the MDGs. Now, what are the limitations of the MDGs? Now, if you look at all those lists, you can see that it is something like a shopping list approach. And that has been based on the requirements and based on the discussions which was done during the meeting of the United Nations with the different countries, but it reached the omission of important issues and also underinvestment in some other key areas of development. And there was a mission goal for reducing inequality within and between the countries. From this, we cannot know about inequalities within and between the countries. And we also do not know about the civil, political, and human rights, which are not represented enough in the MDGs framework. But some of this in relation to peace that has been added in this subsequently in Sustainable Development Goals. The quantitative targets for the Millennium Development Goals, it rely on the epidemiological and also the monitoring tools that many countries lack because of the lack of manpower, the trained skilled manpower. And even if it is available, the data are not necessarily that comparable across the countries because of differences in the process of compilation and also definitions used in those different targets. So these are some of the limitations of the MDGs. And what are the shortfalls for the MDGs in the context of India? There are inequities in the outcome and service coverage. So inequities, that means it is related with the achievement of the targets. Like under 5 mortality rate, that is 73 in Assam as compared to 12 in Kerala. The wide difference is there. Similarly, for full immunization coverage, that is 45% in the lowest quintile, that is lowest quintile means that is approximately 20%, and as compared to the 75% in the highest quintile. And similarly, there are global pharmacies which are available, and if we look at the out-of-pocket expenditures on medicines, because the people are not getting enough of the medicines from the public sector hospitals, and so they're relying on the out-of-pocket expenditures. That is nearly 70% of them are spending on this. There are world-class hospitals in India which is thriving on the medical tourism, but on the other hand, we can see large populations without any access to quality, affordable health services. Again, we can look at India as the largest exporter of the health related manpower, the doctors and nurses globally, but still we do have the significant challenges in relation to these human resources, limited number of doctors and nurses, and the providers are lacking in the rural areas. So these are some of the shortfalls from these SDGs in the Indian context. Now, looking at the investment in health, the public spending on health in India stagnated at around 1% of the GDP for the past 2 decades. On the left-hand side, you can see the government expenditure on health, and in the center, for India, this is 30% and 17th lowest globally. The world average is 60.1, which is nearly double that of India. So the 30% is the government expenditure on health. And if you look at the out-of-pocket expenditures on health, you can see very high. That is around, globally, that is 62.7, although I have told you about 70% in the Indian context. So the question arises, did the SDGs make a difference? Now, let us look at some of the figures which are available. The first one on the left-hand side is on the incidence of the tuberculosis, the actual progress compared with the counterfactuals, which is again projected based on the prevailing existing situation that was in 2000. That is shown in this brown color, and the actual figure is shown in this light, this blue color, blue-greenish color, that the actual figure. By 2010, it has declined tremendously from near about 220 to about between 90 to 200 in South Asia. And for the sub-Saharan countries, again, the projected is very high, and it has again fallen down to near about 300, little above 300 by 2010. And on the right-hand side, about the gender parity in the primary school enrollment, the actual progress, which is compared with the counterfactuals in the South Asia, if we look at this, the achievement is much more as compared to this, but it is again not very high. The difference is not very high. For the sub-Saharan Africa also, that is the difference. It is again, to some extent, it is shown to be higher, but it is again not very high. Now, in continuation, you can also see about the share of people living on less than $1.25 a day by region from 1990 to 2015. The different lines show different regions, and out of these, the dark blue color which I am showing here, that is for the South Asia, which includes India. So there has been a decline from near about 54 in 1990 to about, we can say about 21 or 22. This is the share of the population by 2015. And the percentage on the right hand side shows the percentage of children under 5 who are underweight by regions. Again, we can see a drop for the South Asia, that is dark blue color, from about 127, 28 in 1990 to near about 60 or so in 2015. Then this figure shows about the primary school completion rate, and I'm just pointing out for the South Asia, which is dark blue color here on the left hand side, little above 60 in 1990. It has increased, it has merged in between to near about somewhat above little above 80 by 2013. Now, for the under 5 mortality rate also, there has been a gradual decline from 1990 figures to, you can see by the red arrow here, 2015, again, little above 60. That is a figure, that is the death under 5 mortality rate. Now, for this indicator, the number of deaths for children under 5 years in 2015 for different countries, if we look at this figure, the contribution is still, the number is quite high in India. And this dot, the brown dot, it represents the counterfactual. This is the projected one. So this shows there is a wide gap between the projected figure and the achievement. Now, similarly, for the maternal mortality ratio by region from 1990 to 2013, again, I'm worried about is South Asia, including India, that has again come down from little above 560-70 level in 1990 down to again by 2013 a little above 200. So this is the figure, and on the right hand side the share of births attended by skilled health staff by region. You can see again for South Asia it is just after sub-Saharan Africa, whereas all other different regions they have increased uh, attendance by the skilled birth staff. Now coming to MDG 8 in 2014, the aid has been increased to $135.2 billion. This is based on the partnerships. So when we talk about a partnership, that means the different countries, different regions helping the other countries who are poor and also are not developing much. So in those instances, we can see this figure is quite high. And let us see about what we have made and we have missed by September 2014 based on this small video clip. So let us listen to this.
Poverty rate.
So here we can see that all the targets under the Millennium Development Goal 8, as we have not achieved, some of them are still remaining. So subsequently, it has now moved from the Millennium Development Goals to Sustainable Development Goal. Now, what is a Sustainable Development Goal based on Ban Ki-moon? And this is sustainable development is a pathway to the future. We want for all. It offers a framework to generate economic growth, achieve social justice, exercise environmental stewardship, and also strengthen the governance. So this is these are the words of the UN General Secretary, who has emphasized on the sustainable development beyond 2015. So the Sustainable Development Goals it started after 2015 because there were many unfinished agenda which I have shown you that has been left behind, and so we need to achieve those targets again. The United Nations Sustainable Development Summit was held on 25th September 2015, and based on the recommendations, they have set an agenda with a set of 17 Sustainable Development Goals with 169 targets, which is much more than what we have seen in the Millennium Development Goals. And the main motto is transforming our world. This is the 2000 by 2030. This is the agenda for sustainable development. So If we look at the transition from the Millennium Development Goals to the Sustainable Development Goals, again, in the words of Ban Ki-moon, the UN Secretary General, who has considered MDG as the greatest anti-poverty push in history in mankind. And those MDGs were more specific, it was measurable and resulted in significant results on many fronts. However, they were lacking in some of the areas. So sustainable development goals are considered to be transformational in nature. And there was a meeting that is in 2010 based on this MDG action framework. And in that, they have worked on the basis for understanding the bottlenecks of the progress and the removal by pragmatic solutions. And there were 5 reviews were done subsequently by the UN Chief Executives Board for coordination on the progress of the MDGs. And based on those recommendations, they set 2030 agenda on SDG vision for the unfinished business of the MDGs with a focus on balancing of the economic growth, social justice, environmental stewardship, and linking peace, development, and human rights. So these are the important additions in the Sustainable Development Goals. So what is that sustainable development? Now, as per definition, this development that meets the needs of the present without compromising the ability of future generations to meet their own needs. So this is the basic definition for sustainable development. And this is the blueprint for achieving a better and more sustainable future. And by the year to 2030, the core elements of these sustainable developments are related to the social, environment, and economic development. They're all overlapping. And so what are these SDGs all about? These are integrated, indivisible, global in nature, and universally applicable. And that means this is for all the countries, not just for the developing countries. The theme for the SDGs is leaving no one behind. So that means everyone is included. And with a focus on the equity, inclusiveness, and addressing needs for the disadvantaged populations, the SDGs are unprecedented in scope and significance, and it addresses the social, economic, and environmental pillars for the sustainable development. And there are 5 P's that we need to understand for this SDGs that covers various dimensions to achieve the ultimate goal. You can look at this figure. Those 5 P's are related to people, then planet, prosperity, partnership, and peace. And what is that for the people? To end poverty and hunger in all forms and ensure dignity and equality. They're related to the people. And for the planet, more interested in the environment, and so protect our planet's natural resources and climate for future generations. And the prosperity, to ensure prosperous and fulfilling lives of the harmony with lives in harmony with nature. And so prosperity, that is again economic development. And partnerships, and to implement the agenda through a solid global partnership, that means everyone helping each other. Then last component is peace, that foster peaceful, just, and inclusive societies. So these are all components of that sustainable development. The key components of the agenda include the declaration, there are goals and targets similar to the Millennium Development Goals, the financing and means of the implementation, and there is again a component of monitoring and review by interagency expert groups. So now these are the 17 goals of Sustainable Development Goals. These are more enlarged as compared to the MDGs. I'll start with this one by one. The first one is no poverty. Second is zero hunger. The third one is good health and well-being. This is again purely related with the health, and so I'll be focusing more on these good health and well-being indicators. Then quality education is the fourth one. The fifth one is gender equality. The sixth one is clean water and sanitation. Seventh is affordable and clean energy. They're all again indirectly related with health. Number 8 is decent work and economic growth. 9 is industry, innovation, and infrastructure. 10th is reduced inequalities. 11th is sustainable cities and communities. 12th, responsible consumption and production. 13 is climate action. 14th is life below water. 15th is life on land, and again all are related with our environment. 16th is peace and justice, strong institutions, and lastly 17 the partnership for the goals. So these are the 17 goals of SDG. And for the health specific goal, SDG 3, that is to ensure healthy lives and promote well-being for all at all ages. Here I am giving the three different columns are here. The first one is related to the MDG unfinished agenda, and that is again expanded agenda. And here the targets for this at 3.1, reduce maternal mortality. 3.2 is end preventable newborn and child deaths. 3.3 is end epidemics of AIDS, tuberculosis, malaria, and non-communicable diseases, and combat hepatitis, waterborne, and other communicable diseases. 3.7, ensure universal access to sexual and reproductive health care services. So these are the unfinished agenda, and the new SDG 3 targets are 3.4. This is a target: reduce mortality from NCDs, non-communicable diseases, and promote mental health. 3.5, strengthen prevention and treatment of substance abuse. And 3.6 is reduced by half with 50% the global deaths and injuries from the road traffic accidents. And last one is 3.9, that is reduce deaths and illnesses from hazardous chemicals and air, water, and soil pollution and contamination. So these are the few additions, 3.6 and 3.9, and also 3.5. More emphasis is given on these entities. And on the right hand side, the means for implementation of these targets are given. That the 3A, strengthen implementation framework for the Convention of Tobacco Control, because tobacco is related with all these non-communicable diseases, including the mental health. And 3B, to provide access to medicines and vaccines for all, support research and development of the vaccines and medicines for all. And 3C is increase health financing and health workforce in developing countries. And 3D is strengthen capacity for early warning, risk reduction, and management of the health risks. So these are the different aspects of the SDG 3. Now, if we look at the themes, there is one SDG which explicitly is focused on health, that is goal number 3. There are 10 other goals which also address some health-related issues. But if we look and divide into different thematic areas, there are 7 themes. The first one is related to reproductive, maternal, newborn, and child health. The second component is infectious diseases. The third component, non-communicable diseases, including mental health. Number 4 one is also a part of the non-communicable diseases. That is again injuries and violence. The 5th one is universal health coverage and health systems. 6th one is environmental risks. And 7th one is health risks and disease outbreaks. Now, this is an example of the different indicators, the proposed indicators. I'm not going in details for all the different aspects, but for the reproductive, maternal, and newborn indicators is important. 3 levels of indicators, starting from down below, that is risk factor determinants, and then to the coverage and to the impact. Impact is the ultimate aim, the ultimate goal which we want to have at the end of any program. The ultimate reduction maybe in terms of mortality or morbidity, that is measured by the impact. So coming to the risk factors and determinants, some of the proposed indicators are like child stunting, child wasting, child overweight, maybe in proportions, then access to safely managed drinking water source, access to safely managed sanitation, clean household energy availability, ambient air pollution, again different proportions for different components are available, and others are parts of the targets in goals on poverty, education, gender are also related with that. In relation to the coverage, the proposed indicators are 3.1, that is births attended by skilled health personnel. 3.7, family planning coverage. 3.8, universal health coverage. The RMNCH tracers, that is in relation to family planning, antenatal, delivery care, full immunization coverage, health seeking behavior for suspected child pneumonia, etc. And 37, and model life table systems. And for the impact indicators, these are 3.1, that is maternal mortality, 3.2 under 5 mortality, 3.2 again neonatal mortality, 3.7 adolescent birth rate, 3.9 mortality due to unsafe water, sanitation, hygiene, mortality due to air pollution, household and embedded. Now these indicators are essential for the purpose of comparison, for the purpose of checking the progress, and also from the perspective of comparability between different nations. All these indicators are essential. So that's why there is a need for putting up all these indicators. So now, subsequently, what I'll be covering is part of the performance indicators by India based on the report which is SDG India Index and Dashboard, that is 2019-20, and this is from the NITI Aayog. And so let us see how India has progressed so far. Now here the methodology which they have adopted is they have prepared a composite score for all the SDGs, different SDGs in India. Now for each state or union territory, the aggregate of the performance, the arithmetic mean of the individual goals have been scored, and of the individual goal scores have been done. So that arithmetic mean of the scores is represented here, and the score ranges from 0 to 100. That 100 implies the achievement, full achievement, and 0 indicates no improvement, nothing, no. That is at the bottom of the table, we can say that. And this score for the state ranges between 50 to 70. For the union territories, the range is between 59 to 70, a little better. And if we compare with the figures of 2018, the improvement is there when the states range between 42 to 69. Now it has a bit increased to 50 to 70. And for the union territories, it was initially, the band was 57 to 68. Now it has increased to 59 to 70. Little increase is there. So let us come to these goals. Goal-wise top state in union territory is shown in this figure. Goal number 1, no poverty. The topmost states are Tamil Nadu, Jammu and Kashmir, and Ladakh. Goal number 2, zero hunger, is Goa and Chandigarh. And goal number 3, good health and well-being, Kerala and Puducherry. And I think we need to focus on the health, so I'll be focusing on goal number 6, again, clean water and sanitation. That is Andhra Pradesh and Chandigarh, these are topmost. And similarly, if we talk about the other related ones in terms of the climatic changes, so the climate action, we can see the Karnataka and Lakshadweep, goal number 13. And for life below water, Karnataka again. And life on land is again Sikkim, Manipur, Dadra, Nagar Haveli, and Lakshadweep. So these, some of them have achieved well. So now coming to goal number 1, no hunger. There are different interventions are being done in the Indian context to reduce hunger. One of them is Pradhan Mantri Jan Dhan Yojana. And here we can see that about 377 million accounts have been opened, and the deposits in those accounts was amounted to approximately 1079 billion Indian rupees. Now this Pradhan Mantri Jan Dhan Yojana, it enables direct transfer of the benefits to the beneficiaries through the digital mode. And so this is one of the effective measures for the social security provisions provided by the government of India. Then for universalizing the primary health care, there is another scheme, that is Pradhan Mantri Jan Arogya Yojana program. And here near about 1 lakh sub-centers and primary health centers, these would be transformed into health and wellness centers by 2022 for a comprehensive, affordable, and quality primary care which is close to the community settings. And Ayushman Bharat is another health insurance program. It's one of the components of Ayushman Bharat is health insurance program, which aims to provide 500 million beneficiaries from over 100 million poor and vulnerable families with health insurance coverage up to 5 lakh per family per year for secondary and tertiary care institutions, institutional care, and this also includes the health and wellness centers. And in this, the achievement so far has been like 89.4 million people have already been enrolled and 3.4 million people have already accessed services and avail the facilities. Now, if we look at this, goal number 1, hunger, the right hand side gives you the different pictures. Red is the aspirant based on that composite score 0 to 49, which is the lowest, and this yellow indicates the performer, the green indicates the front runner, and blue indicates the achiever, 100% score. No and for the hunger, there is no achiever, but there are some front runners, like in the states like Tamil Nadu, then Telangana, Odisha, some of the northern states like Sikkim, Tripura, then Meghalaya, and also Mizoram and Tripura. They have all achieved this. They are in the front runner up to 65 to 99 score. But you can see here majority in the Indian subcontinent, majority of the states, large states, and also in the northern states, they are still aspirant. The score is less than 49. Now, if you look at this figure again, 21.92% that live below poverty line in India, but this is based on the 2019 figure, and 28.7% of the households in India have at least one member covered under health insurance or health scheme. Again, less, we need to improve upon this. And as regards to the maternity benefits, about 36.4%, and about 4.2% households in rural and urban India live in kacha houses. So this is the progress of this first goal. The second goal is zero hunger. Let us look at this. We can see the red covering majority of the Indian states and union territories. They are all in the aspirant stage below 49 degree. The front runners are only very few: Kerala, Goa, and some of the northeastern states like Sikkim is there, Arunachal Pradesh, Nagaland, Manipur, and Mizoram. They are in the front runners, but majority of them are still in the red. Now, if you look at these figures again, 34.7% children under 5 in India are stunted, and 40.5% children below 6 to 59 are anemic. Similarly, if you look at the figure for the pregnant women, it is around 50.3%. It is quite high. And 33.4% of the children aged 0 to 4 are underweight. So 1/3 of our under 5 children are still underweight. Now, coming to the third, that good health and well-being, the different indicators are there, but if we look at it, the composite picture shows like somewhat some similarity in terms of all these different colors you can see here, but the front runners seems to be in majority for the good health and well-being. And these are the different goals which I would like to highlight here. On the left hand side, the 3.1 is reduce maternal mortality ratio to less than 70 per lakh live births. So the indicators here are maternal mortality ratio, proportion of births attended by skilled health personnel. And if you look at this on the right hand side, the figure, the mortality MMR, maternal mortality ratio, is 122 per lakh live births, and near about 55% deliveries are institutional. Then on the left hand side, the target 3.2 and preventable deaths of newborns and children under 5 years, reduced neonatal mortality rate to 12 per 1,000 live births, under 5 mortality to 25 per 1,000 live births. The indicators here are under 5 mortality rate per 1,000 live births and neonatal mortality rate by 1,000 live births. Some of the related indirect figures are shown on the right hand side. The immunization coverage for the under 5 mortality and neonatal mortality related with that indirectly, 59.2% immunization coverage among children aged between 0 to 5 years. So we have not achieved that 100% immunization. Now coming to the third one, that is 3.3 on the left hand side, that is end epidemics of AIDS, tuberculosis, malaria, and neglected tropical disease, combat hepatitis, waterborne, and other communicable diseases. The indicators are, these are related with each of these separate diseases, the number of new HIV infections per 1,000 uninfected population. Number 2, tuberculosis incidence per 1,000 persons per year. Number 3, malaria incidence cases per 1,000 persons per year. These are all new cases. Number 4, again, number of new hepatitis infections per lakh population per year. And the last one is number of people requiring interventions against neglected tropical diseases. On the right hand side, there's two figures are here. One is for the HIV, that is 0.07 is the HIV incidence per 1,000 uninfected population. Then on the right hand side, you can see about the tuberculosis, 160 cases of tuberculosis per lakh population. So this is these are some of the figures as of now. Now the other indicators are 3.4, reduced by 1/3 premature mortality from non-communicable diseases. So the indicators are related with mortality from cardiovascular disease, cancer, diabetes, chronic respiratory disease. And 3.5 is strengthening and prevention and treatment of substance abuse, narcotic drug abuse, and harmful use of alcohol. The indicator is coverage of treatment intervention for substance use disorder. And here again, one figure is provided for the suicide mortality rate for the first one, that is globally, the achievement is 10.6. In India, it is a bit higher, 16.3 by 2016. And for the 3.5, the indicator, the second indicator, alcohol per capita consumption, that is for 15 years or over in liters, globally 6.4 liters. In India, it is little lesser, that is 5.7 liters. And the next one is 3.6. By 2020, half the number of global deaths and injuries from road traffic accidents. And here the indicator is number of fatal road traffic accidents within 30 days per lakh population. The global figure is 17.4. In India, figure little lesser, that is 16.6 by 2013. The last indicator is 3.7. By 2030, ensure universal access to sexual and reproductive healthcare services, family planning, information, education, communication, and integration of reproductive health into national strategies and programs. The indicators are the percentage of women in aged 15 to 49 years who are satisfied with the modern methods of family planning. The global figures are 77.4, and India figure is lesser, that is 72 in 2007 to 17. And the second indicator is adolescent birth rate per 1,000 women. The global figure is 43.9, and India figure is lesser again, 28.1. These are again the other indicators. 3.8, achieve universal health coverage, financial risk protection, access to quality essential health services, safe, effective, quality and affordable essential medicines and vaccines for all. The indicators are coverage of full child immunization, antiretroviral therapy, tuberculosis treatment, hypertension treatment, skilled attendant at birth in percentage. Second is fraction of the population protected against catastrophic out-of-pocket expenses. So this means the catastrophic here relates to the severe condition where the patient is expending more than what he is able to get. So that is a catastrophic situation. Now for the 3.9, that is substantially reduce the number of deaths in illnesses from hazardous chemicals and air, water, and soil pollution. The indicators are mortality rate due to air pollution per lakh population. The global figures are 114.1. India figure is much higher, that is 184.5 in 2016. And another indicators for this is mortality rate due to hazardous chemicals, water, soil pollution per lakh population. The global figure is 11.7, whereas in India, you can imagine the very high 187 in 2016. You can see that the pollution levels and the environmental cleanliness is not so good in Indian context. Next is 3.8, that is strengthen implementation of WHO Framework Convention on Tobacco Control in all the countries. The indicator here is age standardized prevalence of current tobacco use more than or equal to 15 years. The India figures are, among the males it is 20.6, the prevalence, and females is much lesser, that is 1.9, based on 2016. Here are again other indicators in relation to the SDG goal. 3B, support research and development of vaccines, medicines for communicable and non-communicable diseases affecting developing countries, provide access to affordable essential medicines and vaccines. The indicators are 3B1, proportion of the population with access to affordable medicines and vaccines. Second, there is 3B2, total net official development assistance given to the medical research and basic health sectors. Now next is 3.C, substantially increased health financing and recruitment, development, training and retention of the health workers in developing countries. The indicator here is 3C1, health worker density distribution per 10,000 population. The global figures here, we can see it is lesser, that is 25. In India, it is higher, that is 30.2, based on the 2006 to 13 figures. The next is 3.D, strengthen capacity of all countries for early warning, risk reduction, and management of national and global health risks. The indicator here is 3D.1, percentage of attributes of 13 core capacities that have been attained at a specific point of 13 core capacities are given in different indicators in different SDG goals. Globally, we have the figure as 71%, but India male it is 95. That is 2010 to 2017. So now coming to the other targets and the goals, the quality education. We look at this figure for India, you can see the mixture of the figures. The aspirants are again, very few states are in the aspirant stage, and foreigners also, few states are there, none of them are achievers. The quality education, we look at the figures, 75.8% eligible children are enrolled into school at elementary and secondary level. So nearly 76% school enrollment. Okay, so. And if we look at the another figure that I would like to highlight here is the 26.3% is the gross enrollment ratio in higher education from 18 to 23 years. Gender parity index, gross enrollment ratio for males and females. And dropout of the school of children at the secondary level is nearly 20% dropout. And about 3% of the children aged 6 to 13 years are out of school. So these are few important indicators for education. Now, the next one is gender equality. Again, you can see for gender equality, it is the whole of India except Kerala and the Himachal Pradesh and Jammu and Kashmir. They are in the red aspirant stage. And so we can see some of the figures here. 8.3% of the seats in the state legislative assemblies are held by women. The sex ratio at birth is still much lesser, 896 females per 1,000 males. And you can see here, 1/3 of the women experience spousal violence. So these are all sensitive indicators of the gender equality. The next goal is clean water and sanitation. And if you look at this, majority of India except Delhi, that is performer, and others are in the front runners. So we can see Delhi is the only one where the performance that is less than 64 score is there. About 100% rural households have got toilets, but in urban households it is lesser, 97.2. And you can see 95% of the households have improved source of drinking water. And the next one is affordable and clean energy, that is 7. The goal is, you can see, you can look at this figure, and many of the states are in the front runner state, that is green, between 65 to 90, and only some of them in the northern part and the central part, little bit some aspects of northeastern states are in the performance stage. We look at this figure, 61.4% of the households in India use clean cooking fuels, and 99.99% of the households in India have access to electricity. So these are good indicators. Now coming to the next goal, that is decent growth in economic growth, goal number 8. To look at this again, the front runners are maximum and few are in the performer state. The aspirants are in the northeastern state, 3 northeastern state and Jammu and Kashmir. We look at the figures, 5.66 annual growth rate of the national domestic product per capita. This is at a constant price. This is the annual growth. Then we look at the unemployment rate, that is 6% is unemployment rate. And about, we can see, we are proud to see that 99.99% of the households in the country have bank accounts. Now next goal is industry, innovation and infrastructure, goal number 9. And if we look at this, again, the pictures are, again, mixed picture is available, but aspirant states, again, we can see many of the states. We look at this, 70% of the habitations are connected by all weather roads. That is progress. And for every 100 persons, there are 49 internet subscribers in India and 88 mobile connections. Yeah, we need to improve on the internet subscriber stays. Now the next goal is reduce inequalities. And here we can see again the front runners are in majority of the states and the aspirants are few, like in Goa and the Uttar Pradesh, Jammu and Kashmir and few of the northeastern states. So here if we look at this, the household expenditure per capita grew by 13.6% among the bottom of 40% of the rural population, and this is higher as compared to the growth in the urban area, that is 13.35%. Now if we look at the Gini coefficient of the household expenditure, that is Gini coefficient is a measure which tells about the degree of inequality in the distribution of certain figures, which could be like household expenditures here, and if it is nearer to 0, that means equally distributed, and 1 is unequal distribution. So we can see in the rural household expenditure it is 0.8 compared to the urban household expenditure, that is 0.36. So it's still much better in the rural household as compared to the urban households. And you can see here about 28.30% of the representation by scheduled caste and scheduled tribe persons in the legislative assemblies. And similarly, the representation of women in the Panchayati Raj institutions is nearly 46.14%. The next one is sustainable cities and the communities. Again, here we can see there are a large number of states which are in the aspirant stage. And if we look at the figures for the sustainable cities and communities, the indicator is 90.99%, nearly 91% wards have 90% door-to-door waste collection facility, and about 5.41% in urban households live in slum areas. Then sustainable consumption and production is the next goal. To look at this, again there is a mixed picture, but here we can see one achiever in this, that is one northeastern state, that is Nagaland, has achieved the 100% score in this index. Now some of the figures are in this regard is 63.33% of the net available groundwater is withdrawn, and about 20.75% of the municipal solid waste generated is treated. So a large quantum of the municipal solid waste are still not treated. And we can see on the right hand side lower most corner, about 4% of the hazardous waste generated gets recycled. It is again not up to the expectations. Now coming to the next goal, that is climate action. We look at this, again there are a large number of states which are again in the red, both in the northern state, northeastern state, in the south, including Tamil Nadu. And here if we look at the figure, there are 16 lives are lost due to extreme weather events in 2017 and 18. This is per 10 million people. And if you look at another figure, that is 35.22% of the total electricity generation is from the renewable energy. So this sector is now gradually given importance, and the government of India is also putting more emphasis on it. And so this is where we can see that on the right hand side, the 24.3% of the share of the solar power in the total renewable energy basket. This is from the solar power. Now the next one is life below water. And here we can see the importance of the mangroves. The 3.82% area are under the mangroves. And we can see here the 11% of the available potential areas on the right hand down corner. 11% of the available potential area developed under the coastal aquastructure. So 11% only, but we need to improve upon this area as well. Now the next one is life on land. Here we can see majority of the states in green, that is front runner, except one state, that is Haryana, in aspirant states. And there are two states which have achieved that 100% score. That one is Sikkim and another is Manipur. And if you look at the figures, about 21.54% of the land in India is covered under forest area. And if we look under the total geographical area coverage, the tree cover is only 2.85. An increase in the area under desertification is near about 2%, which is again alarming, because we need to halt the process of desertification. The 16th goal is on peace, justice, and social institutions, strong institutions. And here we can see a large number of the states and union territories in the front runner, except few of them in the performer state, and none of them in the aspirant states. When you look at some of the figures here, 88.8% of India's population is covered with Aadhaar, that provides universal legal identity, and 86% of total births are registered, which is a very good sign, although we hope to achieve 100% registration. And 13 courts per 10 lakh population, with the availability of the courts in relation to the justice. The last one is a partnership. And in this, the states are building partnerships with various stakeholders, and these are multilateral organizations, the academic institutions, the civil society organizations, and the private sectors, and to achieve the whole gamut of development targets. So this completes the different aspects, the different goals of SDGs. Now, coming to what are the opportunities and challenges. The opportunities are the sustainable development goals are more ambitious, and this is compared to the Millennium Development Goals, and it covers a broad range of interlinked issues. And there are partnerships between the government, private sector, and other organizations are there. There are many opportunities that can be utilized under this. There are valuable opportunity to adopt the developmental pathways. However, challenges do remain. For Indian context, the challenge lies mainly in the finance, and that the financial shortfall of about 36 lakh crore rupees per annum. And that is again one of the biggest hindrances, the challenges. And developing capacity to address the economic growth, industrialization, employment, basic infrastructure are again other challenges which India is facing. To summarize, the MDGs are narrow in range in developmental outcomes, which has got 8 goals and 18 targets. The limited set of developmental targets are there. And MDGs are relatively silent about the impact of peace and security on human development. They're mostly independent of each other through health, though health is given due importance in one of the MDGs, 6 of the MDGs. Now, if we compare this with the SDGs, in short, the SDGs cover larger developmental areas with multiple developmental targets, that is about 17 goals and 169 targets, and which are relevant in all the countries, irrespective of developing and developed countries. It identifies peace and security as necessary conditions for development, and they are cross-cutting and interlinked by design. So these are in brief about the MDGs and SDGs. Here are some of the references for further readings, and I hope you can go through them if you want. So this is all about the Millennium Development Goals and SDGs, and I would like to complete here by saying, from the words of Mahatma Gandhi, the future depends on what we do today. So this is all for today. Thank you.
Is there any questions? Please ask. Thank you, sir.
No sounds. Oh.
You lost my code. I have reached it. Now I can't see the screen.
आप इसको जो है ना हम इसको उसमें कर देंगे, कन्वर्ट कर देंगे इसको और डाल देंगे इसको जो है ना.
So we have received few queries that audio was not available for some time and video was not seen for some time. So we will be uploading this in YouTube video and the link will be shared with all of you. So those of you who could not access the full session can see through the YouTube link. Is there any other doubts?
Okay, thank you.
Thank you. So we are closing the session.